But I wanted to begin up front to announce a new partnership we're advancing, to announce a new approach that we are pursuing in an effort to disrupt the testing market, to bring our market share into that market, to bring down costs for everybody, and improve reliability and access for everybody in terms of getting tests and getting, more importantly, test results back in a timely manner. There's an old saw that says, if you continue to do what you've done, you'll get what you've got. Right now, we are facing the prospects moving forward over the course of the next number of months of moving in to flu season. Time for flu season, of course, puts tremendous stress and demand for testing. People that develop flu-like symptoms are going to understandably and likely request that they get tested not only for flu, but also get tested for COVID-19. In anticipation of some of the stress that will place on our testing system, in anticipation of addressing some of the existing and persistent challenges with getting timely test results, as well as providing the kind of access, the quality access that provides for a lens of equity in terms of the testing, we're moving now in a new direction. Let me set let's give you an overview broadly of where we are in terms of what we're currently doing in terms of tests in the state of California. We have averaged roughly 100,000 tests every day in this state. You saw a few weeks ago it was over 132,000. We've been challenged by this heat wave and by these wildfires. But let's just put that slide to test roughly 100,000 or so tests a day. The average turnaround time on the test we've seen go north of 10 days, some cases 11, 12, 13 days. A few months ago, we're currently averaging, current average is anywhere from 5 up to 7 day turnaround on the test. Each and every day is a precious day in terms of the test results. Once you get past a few days, those test results lose their resonance, lose their meaning and significance in terms of our capacity to mitigate your exposure, mitigate the spread of the disease, be able to do the kind of work that needs to be done in terms of the contact tracing, the quarantine, and isolation. In essence, when you're north of 10, 11, 12 days, the tests, dare I say, are quite useless. But they're also quite expensive. The average cost of what we refer to as a molecular diagnostic test, these are the PCR tests that many of you are very familiar with. The average costs of those tests is $150 to $200, which is quite significant. Just consider the state of California has done just shy of 11 million tests. You can pull out your calculator, do the math on 10.8 million tests, averaging anywhere from $150 to $200, the extraordinary cost of that diagnostic. We are now moving forward in a different direction to disrupt the market by partnering with someone who's very familiar, certainly to me as someone who's had 4 kids, the Perkin-Elmer test that many of you that have had a newborn baby are familiar with. In the state of California, we've had a partnership with Perkin-Elmer doing genomic diagnostic testing over 30 years. They're a partner that has proven to be effective and efficient and reliable for decades in this state. They are moving and have moved very aggressively in this space. And as a consequence of the development of the partnership that goes back years, an investigation of what is available in the market today by our testing task force, a needs analysis that was put together over the course of the last number of months. We have formalized a partnership now with Perkin-Elmer to build out a new laboratory here in the state of California with Perkin-Elmer's capacity to provide the full supply chain in terms of the reagents and the roughly 20 different ingredients that go in to a test. The state will be accountable for logistics and billing. We have other work that we're responsible doing, but this provides us the ability to have much more stability and the ability to provide more reliability to people that are at risk, essential workers, to address the issue of the supply chain constraints that we think will only grow, not diminish, into the flu season, to provide, as we say in this slide, some insurance against what we lazily refer to as the twindemic of flu and COVID season, to provide guarantees in terms of turnaround time for results, and ultimately to drive down the cost for everybody. This is exactly what the federal government should be doing. And had the federal government done this some time ago, you wouldn't see average cost of tests at $150 to $200, costing the taxpayers quite literally tens of billions of dollars, costing employers billions and billions of dollars, costing the health plans billions of dollars as well. We think by advancing this partnership, as only California can, with the scale of our purchasing power and the need to test more people in this state than any other state in this nation, that we will be able to use that market scalability to drive down costs across the spectrum for employers, for plans, for our Medicaid system, Medi-Cal here in the state of California, and of course Medicare system that currently is reimbursing over $100 per test. California is committing to a diagnostic testing partnership that will provide an additional 150,000 tests per day. So we're averaging over 100,000 tests a day. We were doing well north of 130,000 before the wildfires. We'll get back up into that range very shortly. This is additive. It's not a substitute. All the existing testing protocols that are currently in place, all the partnerships that we have advanced with our labs up and down the state, and some of these more mobile testing sites, we are only looking to disrupt the costs of that system, but not the access to those tests and those diagnostics in the existing system. But we want to add on top of it. But what is significant in this partnership is we are demanding test results back within 24 hours, the latest 48 hours, and we have provisions in the contract to guarantee that turnaround time. You get in within 48 hours, certainly within 24 hours, then we have the ability to make decisions in real time that will advance our efforts to reopen our schools for in-person education, reopen our businesses in a more effective and efficient manner, in a more sustainable manner. And by the way, we'll be putting out those guidelines Friday in terms of the new strategies we are advancing as it relates to reopening, based on some of the positive news that we will advance here in a moment in terms of our positivity rate and in terms of our hospitalizations and ICUs. But on testing, that's foundational. If we're going to sustainably reopen, we have to have the testing capacity. We have to have the results in a much more efficient period of time, allow us to make decisions on contact tracing, again, isolation, quarantine, and the like. Here's the new cost breakdown. Again, $150 to $200 was the average per test. Under this new partnership, our cost breakdown works accordingly. For up to 40,000 tests, the cost